up. You're always teaching them to lengthen, create more space. So into the lumbar, we're now into movement of flexion and extension. So mostly at L5-S1, where does the most injuries happen usually is L5-S1. That's where we wear out because that's where we move most. But we're limited into rotation and side flexion. And that's why when you're going into your pose, who does it in, can I get you to go into a lying twist like we did last night, please? Yes?
With the knee all the way to the ground?
That's what she'd normally do. Yes.
I tend not to anymore.
No, I know, but you're just doing. So there's too much happening here, and she's a journalist, and she's stiff right into there. Yes, she goes a little squeak. Anchor this foot, use the belly, take this hand, and as she comes across, she's drawing this elastic strength of her belly, so she's going to go to there, and she's going to breathe down into the nice to the shoulder. She's going to come into there. Feel the difference. The stretch is in the thorax. But what do? We leave this up and we pull the leg over, we lever it, and we create strain here. I know she can do that there, but I'm wanting to target this thoracic. So I get them to breathe down into that area. Whoa. Thank you. So that's the difference.
So with that, I also notice a lot of people have the shoulder lifting.
Yeah, I get them to take their arm always below shoulder height because this is impingement for shoulders anyway, and I drop down and I get them to actually breathe into, and there's a lovely rotational stretch which we'll do when we're lying down, where most people just do it in the shoulder, but there's a lovely way that you can actually take the thorax back and then open the arm like a wing. Yeah, but it's the way you ask them where to move. So it's getting the movement where you want. The body's clever. If you're stiff, it goes, oh, I'll just get it somewhere else. You know, they borrow. It's like kids. They take all your good clothes and you go to find them and they're gone. You don't have adolescent children. You wait. You'll go and they've taken your favourite things. The same, the body's clever. It goes, yep, I'll borrow from there. And so in the end, you are depleted. It's borrowed too much from that area. So what you're doing is shoring up the area and then getting the bit that should be doing it to do it. And that's a great skill that you're going to take away from here.